Good day everyone, I am Laika Pontevedra from Northeastern Mindanao State University. As per requirement for the course Bio 117, which is Parasitology, for our midterm requirement, we are tasked to have a discussion for a certain parasite.
So, the parasite that I choose is the Giardia lamblia, or also known as Giardia duodenalis or Giardia intestinalis. It is a flagellated parasitic protozoan microorganism.
So what we will talk about in this discussion is first, to know the etiology of Giardia lamblia, to know its characteristic, life cycle, mode of transmission, and the prevention and treatment of this causing disease parasite. The etiology of Giardia lamblia. Giardia lamblia is also known as Giardia duodenalis and Giardia intestinalis. It is a flagellated unicellular eukaryotic microorganism that colonizes and reproduces in the small intestine. It is commonly causes a gastrointestinal condition known as giardiasis. There are two types of Giardia. First is the active form. It is present in the gut of an infected person or an animal. The second form is the inactive cyst form. It can remain dormant in the environment for several months. Characteristics: Giardia lamblia exists in two forms. First is the trophozoite or the vegetative form, and cyst or the cystic form. First is the trophozoite. The trophozoite is in the shape of a tennis racket or heart-shaped or pyriform shaped. It is rounded anteriorly and pointed posteriorly. It has falling leaf-like motility and measures 12 to 15 micrometer length and 4 micrometer thick. It is dorsoventrically convex and ventrally. It has concave sucking disc which helps in its attachment to the intestinal mucosa. Hence, it appears as sickle-shaped in a lateral view. It is also a bilaterally symmetrical on each side from the midline, and it possesses first one pair of nuclei, 4 pairs of flagella, 2 lateral and 1 ventral, and 1 quadral pair of flagella. Blephoroplast from which the flagella arise, which is 4 pairs. 1 pair of axostyles running along the midline, 2 sausage-shaped parabasal or median bodies lying transversely posterior to the sucking disc. Next characteristic or form of Giardia lamblia is cyst. A cyst is oval in shape and measures 11 to 14 micrometer in length and 7 to 10 micrometer in width. It is surrounded by a hyaline cyst wall which likely protects them from the environment. It contains 2 or 4 nuclei depending upon the stage of maturity. The axostyle lies diagonally, forming a divided line within the cyst wall. It also contains remnants of axonems or basal bodies and parabasal bodies. It is the infective form as well as the diagnostic form of the parasite. For the life cycle of Giardia lamblia, it has 5 stages. In stage 1, the cysts are hardy and can survive several months in cold water. Infections occur by the ingestion of cysts in contaminated water, food, or by the fecal oral route, such as hands or termites. In stage 2, in the small intestine, excistation releases trophozoites. Each cyst produces 2 trophozoites. In the third stage, trophozoites multiply by longitudinal binary fission, remaining in the lumen of the proximal small bowel where they can be free or attached to the mucosa by a ventral sucking disc. In the stage 4, encystation occurs as the parasite transits toward the colon. The cyst is the stage found most commonly in the non-diarrheal feces. And in the last stage, because the cysts are infectious when passed in the stool or shortly afterward, person-to-person transmission is possible. While animals are infected with Giardia, their importance as reservoir is unclear. Mode of transmission of Giardia lamblia. First is the transmission via hand-to-mouth. Transmission occurs from person to person and animal to person via hand-to-mouth. Transfer of cysts from infected faces or fecally contaminated surfaces. Second is the waterborne outbreaks. Waterborne outbreaks may occur as a result of fecal contamination of public water supplies or recreational swimming areas. Third is the contact with feces. Anything that comes into contact with feces from infected humans or animals can become contaminated with the Giardia parasite. Prevention and treatment. For prevention, Giardiasis is widespread in sub-Saharan Africa, South and Southeast Asia, Central America, western parts of South America, Russia, Turkey, Romania, and Bulgaria. Statistics suggest that 200 million people in Africa, Asia, and Latin America have Giardia with symptoms, and many others do not know they have it because they do not have any symptoms. For this reason, it is important for travelers to be aware of the signs of Giardiasis and to take certain precautions. First is hand washing. Wash hands after using bathroom or changing a diaper and before eating or handling food. Second is drinking water. Beware of water in rivers and lakes when camping. People should take their own water supply or some means of boiling or purifying it. Third is food. Avoid eating raw foods and foods washed in water that could be contaminated. Last is brushing teeth. When brushing teeth, use purified water. And for the treatment of Giardiasis, in most cases, Giardiasis eventually clears up on its own. Your doctor might prescribe medication if your infection is severe or prolonged. Most doctors will recommend treatment with antiparasitic drugs rather than leaving it to clear up on its own. Certain antibiotics are commonly used to treat Giardiasis. First is the metronidazole, is an antibiotic that needs to be taken for 5 to 7 days. It can cause nausea and leave a metallic taste in your mouth. Next is the tinidazole, is as effective as metronidazole and often treats Giardiasis in a single dose. Next is the nitazoxanide, is a popular option for children because it's available in liquid form and only needs to be taken for 3 days. And last is the paramomycin, has a lower chance of causing birth defects than other antibiotics, although pregnant women should wait until after delivery before taking any medication for Giardiasis. This medication is given in 3 doses over the course of 5 to 10 days. So that's all for Giardia Lamblia. I hope you learned something from the discussion, and please be aware of your surroundings, especially when you are eating and drinking. Thank you!